This hospital is an enormous resource to Houston and to the region.
Texas Children's has grown into the best children's hospital in the world.
We're an international children's hospital.
It's one of the premier institutions in the nation.
The nation's largest freestanding pediatric hospital.
Its excellence is known far and wide.
We have an incredible breadth of expertise and experience.
We rank among the top children's hospitals in the United States in NIH funding.
It is not like any other hospital I've ever been in.
Our graduates include 10 chairs of pediatric departments.
The best and the brightest young investigators who are doing great science.
If it's being done, we're doing it, and there's a lot that we're doing over and above. Texas Children's Hospital is actually leading the path here.
Since they're on the cutting edge of research, they have best practices and know precisely what to do, and they're inventing medicine.
We also have the resources of the Texas Medical Center to draw on.
From MD Anderson Cancer Center to two great hospitals, St. Luke's and Methodist Hospital.
There are experts in virtually every single aspect of medicine and research today.
I don't know of a place in the United States that has this amalgamation of hospitals.
Collaboration is the name of the game.
We're going to do incredible things. We are going to cure diseases. It gets you excited and you want to be a part of this.
The patient care at Texas Children's Hospital is legendary.
We record more than 2 million patient encounters per year.
You're in awe of their competence, commitment, and compassion.
Everyone that I met there was so loving and so kind and so committed to making a difference.
We in emergency medicine look more broadly than most specialties do because we need to see all that it could be. And the only way you can deliver effective emergency care is if the team is functioning as a team. You're dedicated to providing those children the best possible care.
Take a look at him. He's an absolute miracle.
She's having a life we didn't think she'd ever have.
And if it wasn't for Texas Children, he wouldn't be here right now.
I don't think Joseph would be alive right now.
My boy wouldn't be alive. Period.
The Cancer Center at Texas Children's Hospital is one of the very best in the nation.
All of the subspecialists are here 24 hours a day.
We have 28 different laboratories performing state-of-the-art research.
This just doesn't exist anywhere else.
Every day of the week, we have hundreds of patients that come to our hospital who are in underserved communities.
The hospital gives a lot of money for charity care, over $100 million a year.
We take care of children, regardless of their ability to pay.
Regardless of their religion, their ethnicity, children not just from Texas, but also from every state in the U.S. and from more than 70 other countries around the world.
We're committed to a global community of healthy children. We started the nation's first ever pediatric residency program in global child health, working either in Africa with underserved populations or in some cases right here in Houston in underserved parts of the community. We have the opportunity now really to become the drivers of innovation in pediatric health care for a generation to come.
That's the kind of institution we are. It's around education and research. With the entrepreneurial spirit of this organization, that's how you get Vision 2010.
Texas Children's Hospital had become the largest children's hospital in the United States. We started asking the question, what now? We had an eye toward doing some things for children that no one else was doing.
Extraordinary set of both physical and dynamic facilities.
Texas Children's Hospital has been the key role player in this process from its infancy.
It's the first pediatric institute where we bring together under one roof pediatricians, neurologists, geneticists, neurogeneticists.
To eradicate many diseases before they even strike.
This is practical. This is what's going to accelerate discovery.
We have breakthroughs in Fragile X syndrome, Angelman syndrome, autism. But you know what? They're all being done here.
We're going to be able to make a tremendous difference in children's lives for generations to come.
An entire, almost million-square-foot facility dedicated to obstetrics and gynecology and fetal intervention with all of the subspecialties that we need and all of the support.
It's one-stop shopping for a mother. She comes in, she gets imaged, she gets her counseling, she gets seen by the subspecialist. It's all right there.
Until this time, women's services have been tucked into the back of adult hospitals. Women finally have a building that makes a statement for them.
I just think it's terrific. I don't think that there's another place like this in the world. My colleagues are jealous, basically.
This is the future for what children's hospitals are going to look like in the United States.
Everybody's aware of what's going on down here. I mean, what's going on here is unprecedented.
We are not here to do what everybody else does. We are here to move the field and do what nobody else has ever done.
That's why I do this job. It's not about me, it's about these people, because they're going to make a difference and we're going to cure kids. And I think most people recognize that it's a once-in-a-lifetime opportunity.
Well, I think it's a very hopeful time.
We are really marshaling the troops for a major advance.
We're working at it every single day, but we can't stop now. We've got a long way to go to make all of this a reality.
If you believe that the future of this nation depends on the health of our children,
There's nothing more noble than doing research to help patients.
Everyone immediately lights up and says, wow, I want to be a part of that.
I think it's only the beginning. The sky is the limit.
When it's all said and done, at the end of every day,
There's nothing more important than the health of children.
there is no more worthy endeavor.
it's about healing sick children.